All right, everyone. I'm here with Mr. Hootan Shahidi of Crossover Dental Enterprises, what I like to call C.O.D.E. Crossover Dental Enterprises, way too long of a word.
It is. That's why C.O.D.E. is a perfect acronym.
Yeah. So Hootan is an expert in medical billing. In fact, he leads all the medical billing programs at 3D Dentists. So tell us, why are you passionate about medical billing?
Passionate about it because it's a great way to help patients make sometimes very difficult treatment affordable. Okay. It helps offices bring in a different revenue stream that they're not tapping into. And it also helps with case acceptance, which ties into being able to help patients.
Okay. So what led you to get into medical billing?
I was consulting in California after being an office manager for a number of
For a dental practice?
Yeah, several dental practices from about 27 to about 31 age-wise. And then I was looking for something that dental offices were not good at, that maybe I was good at.
You're looking to fill a niche.
Yeah. And so I saw, okay, this was, medical billing is something that most offices don't seem to be doing, but it could be a help. So that's how it started. I started locally in Los Angeles with friends and family and getting, kind of it set up, trying to figure out how to scale it. So a trial and error period. That was for about a year. And then in 2013, I started C.O.D.E.
Okay. And your company is dedicated just to medical billing for dentists?
Correct.
Okay. And how many clients would you say you have, and how many states do you work in?
Doctors wise, it's probably a little over 2,000, about 2,100. That's about 700 practices, because some practices are husband and wife or family or
multiple
10, 15 associates. We have offices that big. And it's 45 states or 46 states.
So would it be fair to say that you have good experience in most states in the country?
Yeah, I would say majority, yes, are good.
Okay. So if somebody wanted to call you and find out about how good medical billing is or some of the nuances of their particular state, you'd be more than happy for them to do that?
Yeah, totally. I wouldn't want somebody to go down a route that may not be beneficial for them in the way that they suspect. So one of the things that I try to at least set up in the conversation is expectations of what you really should be expecting in your area. Yeah. Historically based on our data, of course.
I think of all the things that we do at 3D Dentists, medical billing is probably the one thing that people come in with the most myths about.
That's true.
And because, quite frankly, they've probably heard from so many different people that it doesn't work. Along that line, what are the obstacles that are holding dentists back from doing medical billing?
Some dentists that call us think that it might be too much work for their team. Okay. My team is already busy calling patients, scheduling, treatment planning, case accepting, doing all this stuff. How then am I going to layer this in? So that's typically one obstacle that they refer to. Another one is this myth that, it doesn't work. Like you'll never get paid. Like
I've heard from another dentist that it's illegal or it doesn't work or they never pay. Or my favorite is when people say, well, all my patients have high deductibles. I'm like, so none of your patients work for corporate America?
Or sometimes I'll ask when somebody says that, I'll be like, oh, you already do medical benefit checks in your office? They're like, no, I've never done one.
Yeah. So how do you know?
How do you know?
Yeah. So they probably check their own deductible as self-employed dentists. And we probably have $6,000, $7,000 deductibles. So, but that doesn't represent corporate America. And what would be another obstacle that you're finding? Would be something along having predictable systems in a practice?
Systems, workflow, a consistent workflow that you stick to. I was here 2 weeks ago in Raleigh. We missed you, by the way. You were not here, and went out with one of our former students from or dentists
close by,
who came
with Ralph.
Yeah. He's been to things, and we were with another dentist, and I think at some point one of them. Their office manager was sort of demoralized by about 3 or 4 months of denials, deductibles, and stuff. Coincidentally, at almost the same time, it had happened to Ralph, but they just kept firing.
Yeah.
November, December.
Yeah.
Oh my. Yeah. So had he given up, think about or if his office manager had given up, think about what they would have left on the table.
It reminds me of my story of medical billing.
Yes.
Similar. When I first started, I had met you in California. In Dana Point, actually, and we started with medical billing, and I had somebody in my office, quote unquote, in charge of it. And the first couple of months, 3 months even, we got nothing or very little. and basically at that point we deemed that it didn't work and we quit, and then, me being resilient and never giving up, essentially, especially when other people tell me they're doing it, at that point I'm like, if they can do it, I can do it.
Yeah.
And, and then what happened is we started again and the same thing. First couple of 3 months, very, very little results. But then this time we just kept through it. I just kept telling the team, just keep doing it, keep doing it. And it was just like this upside down cliff. Like suddenly we were just going like this and then boom, it went up. And then we've just been continuous since then. But one of our keys was just being consistent and letting the system work and giving it time. Mm-hmm. In fact, I think one of the things we talk about in our training programs is that you have to be committed for 6 months to really start seeing the results. Would you think that's fair?
6 months, and then also be prepared for these cycles, right? Yeah. So you should expect unusually good success in November, December.
Yeah, Q4.
Just like when you're submitting Q1, you should expect there's deductibles still in play and all these other things. And that's just part of it.
Yeah. So it's understanding how medical insurance works. Yeah. I mean, it's a little different from dental insurance because dental insurance, we don't really.
More than a little.
Right. Well, in dentistry, we don't really have these deductibles. If the deductible's there, it's $50. It's essentially non-existent. So we're not used to that from that sense. The other thing with medical compared to dental is with dental insurance, typically they just pay. Mm-hmm. And with medical insurance, there's a thing called medical necessity where they have to do that. So what are the best ways for a dentist listening to this to overcome these common obstacles?
One is obviously education. Okay. That could be as simple as various articles in magazines. That could be to go courses that talk about medical billing, books. I mean, online, there's a lot of resources.
YouTube.
Yeah, YouTube, just to get the fundamentals on you, under you. So that's certainly one obstacle. One form of dealing with an obstacle. Another probably a good way to really assess the medical billing thing is thinking about the procedures that you do. Mm-hmm. A lot of dentists think, well, I just got an email like this the other day saying like, hey, well, it sounds like you provide a really great service, but like I don't do anything that's billable. Mm-hmm. So I'm like, okay, well, and I responded back. I'm like, well, do you do exams? 2D imaging, basic appliances for bruxism, TMD, and stuff like that, and some trauma occasionally. Doctor said yes. And I said, well, there's some stuff already. Now maybe if we talk more about it, maybe we'll discover there's some even more things that you're maybe not thinking that you can bill to medical. So and that comes in with the education part. Just explaining, okay, well, what is really billable, and giving the dentist that opportunity to look at those things. And then, there's some things that dentists add over time. And so if medical billing, let's say, for example, if medical billing covers sleep apnea, and you're interested in sleep apnea, let's go that way.
In our office, there's infant phonectomies.
Okay, so, oh my God, I can't believe you just said that. So my next line was going to be, and I'm not saying this is because of you. There's a lot of factors, sleep apnea and all these different programs addressing it. But lingual phonectomies are maybe the rookie of the year.
Yeah, of course.
In terms of 2018, in terms of I think in 2018 as a company, we billed it more than the entire existence of the company. So
the previous 4 or 5 years.
Yeah. Yeah. I don't think so as much as this year. I mean, we probably do it 10, 15 times a day now.
Wow.
Yeah.
And it's one of those claims that actually pays pretty consistently.
Very consistent.
Yeah. Because it's medically necessary.
Very medically necessary. Most PPO policies, if the child is under a year, it's pretty much built in. Good chance it's going to go through.
One of the obstacles, one of the things that allowed me to overcome the second time around with medical billing is I stopped thinking fancy. When I started medical billing the first time, I was thinking about, my extraction case, my full arch extraction cases, my complex cases, my super medically compromised patients. And while all of those are potentially true, what I learned was getting simple. Exams, imaging, some of the things that quite frankly we were giving away in our office, some of the things that are very simple that we're literally doing dozens of times per day. But what I tell people is they don't pay the big numbers, they just pay the regular. They pay more smaller numbers much more consistently. And I think the saying I always say is I'll $10 you to death, or I'll $20 you to death. And $20 times 10, 20 times a day adds up to a good amount of money. So,
you were good at that. You were good at staying with those core fundamentals.
Yeah.
We used to get into some great battles back then.
Yeah.
I'm glad I lost.
Yeah.
Because remember, I was like, oh, dude, let's just come out the gate with sinus slips. This is,
But those, see, to me, what happens there is it's a telltale sign to me. Okay. When when general dentists bill those procedures to medical, it's not that it doesn't work. The problem is most GPs don't do those procedures regularly.
And certainly not 10, 12 times a day.
How good are you going to be at anything, medical billing included, specifically? If you're only doing it once every couple of 3 weeks and you file literally like 4 or 5 claims a month, you're not going to have that. You're not going to have success.
Sure.
So what about overcoming the obstacle of my team doesn't have time? I don't want to do this in-house. What would be your suggestion?
That's where we could help. A friend of yours and I's, Sully, plug. Sully texted me and something came up. He was like, so about benefit checks. He was like, sometimes your benefit checks take a few hours. And I'm like, yeah, well, because we get so many and there's a queue and all this. So he's like, oh, well, why don't I just have my person call? I'm like, well, you're welcome to, but I don't know if that person wants to sit on hold for 20, 30 minutes. I'm happy to show you how to do it online in 30 seconds. Point of it is, though, that let's say if you didn't know that and you were trying to do this on your own and you didn't know how to do it online, what codes to put in, you've seen this, what diagnosis codes to put in, this could become a very daunting, quick 20, 30 minutes gone. And
it's real easy for a team member to give up and tell you it doesn't work. And for you as the dentist who's got your head in the patient's mouth, 4 or 5 days a week, to just say, okay, it doesn't work, and to continue to do what we've always done.
Yeah, so a third party could help in terms of that time of benefit checks, staying on the phone, doing the pre-auths, whether that's online or on the phone. Then, of course, filing the claim with a certain level of expertise.
I think it's about the follow-up on the claims.
Then the final one, the most important one, is that follow-up. Do you know how to deal with the policy, what to say, how to control the conversation, how to get past a lot of their tricks. For example, my team, and I'm sure your team, Melissa in particular, knows, for example,
she knows like who to call with a certain type of claim.
Oh yeah, because there's certain people, like the first level person who picks up the phone will be like, oh well, we don't see any sleep test attached with this claim, and you're like, no, go look at the, you tell them essentially what to do, and they'll be like, oh, sorry, we found it. Okay, that sort of stuff, those tricks.
That just comes through repetition.
A lot of repetition.
Yeah. So what I always tell everybody is, in the beginning with medical billing, more so than anything else, is you start by outsourcing it. In other words, get your internal workflow about what to bill, when to bill, what notes to write, all of those things. Get those worked out. Don't worry about the nuances of billing and all of those things. Let a professional do that. And then once that you see that this is actually working and makes sense, then insource it. Then go ahead and consider bringing in your own medical biller or carving out time for your own dedicated team member to do it. And that's what we did. And that's where we found the most success, is by getting our clinical workflow in place, outsourcing the administrative side of it to your company. And then once we reached a point where it made sense to have somebody inside, then we brought somebody inside. Mm-hmm. And that's certainly a flow that works. And quite frankly, what most people find is that a lot of times they don't want to do the internal billing, but they definitely want to control what gets billed through a company. Sure. So what would success look like for a dentist that implements medical billing? How would they know they're being, what can they expect from that? What benefits would they have?
So from the money standpoint, typically what we're seeing conservatively, if the office has a good mix of some exams, some 3D imaging, little oral surgery, maybe an appliance here and there, pretty conservatively, it could add about 10%. So straight up,
if a practice is doing $1 million,
they could add another $100,000 in collections. Okay. Pretty straightforward.
Now, I want to point out one thing, if you don't mind. Is this, and I think this is what's lost in all the talk about medical billing, is that this additional revenue comes without seeing any more patients.
Sure.
This is revenue from existing patients, from existing procedures that you're already doing, oftentimes many of the procedures that we're just giving away for free, or procedures that where medical actually pays significantly better than dental insurance. And to me, the biggest one by far, the two biggest ones that I see are exams and cone beam. Okay. Most dental insurances don't pay for cone beam, but medical insurances do. And most dental insurances pay pennies or, tens of dollars on exams, but medical insurance can start paying in the 80, 90, in our example in the state of North Carolina, close to $150 for a level 3 exam.
Much closer to most dentists UCR. Certainly.
Yeah, absolutely.
Historically
and honestly, it values our time a little bit more normally.
Yeah. And it's funny because physicians complain that it doesn't pay enough.
Well, we've been beaten down so bad by MetLife, basically, that it's that way. So from the money side, certainly there's that. But what else? What if the dentist says, "Hey, listen, man, I'm making plenty of money. My revenue is great, although it can always be greater." What are the other benefits for them?
So if that is the argument from the dentist, I get it. But probably the other part is, let's look at it from the patient side.
Right.
What can you do to satisfy that patient or give a better patient experience? So you might be wealthy as the practitioner, very well off, and life is great. But that patient who just paid $5,000 at your office for X case, maybe if you get $2-3 of that back, that's
even $500. $500. What patient says no to getting a bonus of $500?
Might be 1 month car payment for them. $2,000
it might be the next crown for them. It might be the next quadrant of fillings for them. It might be the next root canal.
Yeah.
Ultimately,
do more dentistry.
Ultimately, I always say this is at the end of the day, our boss is the patient. Mm-hmm. And anything that we can do to remove a barrier for the patient to say, yes, it's good. Okay. Now, if we can generate more revenue at the same time, even all the better.
Right.
And it's worked out great for us. I can think of several patients where, they did the dentistry and it was a lot of money and it held them back. And we were able to get medical insurance benefits and give them money back. And they didn't go spend the money on vacation. They said, great, let's get the next part done. Mm-hmm. And to me, that's really the benefit of it, is one of the main benefits of it. So now we've talked about medical insurance, the benefits, the obstacles, all of those things. So ultimately, the biggest benefit, and one of the reasons we do this particular podcast is we offer training for dentists to learn how to do medical billing in a predictable, ethical, and team-oriented workflow. So talk to us about what are some of the key concepts that we teach or that you teach at our medical billing training programs.
So essentially it's one day, basic like 8:30 to 4:30 type course. We go over all the procedures that could be billed, so the cross-coding that you hear about. We go over the diagnosis codes and kind of how those two pair together, because that's a very important thing. Well, what procedures and what diagnoses.
So that diagnosis codes comes to medical necessity.
Correct. How that fits, how that makes sense. Go over documentation, benefit checks, pre-auth, those components. And then towards the last part of the afternoon, we really just talk about the team workflow. How does back office and front office communicate? How do they get the information out? What's a good system to follow? How do you keep it consistent? What should be your expectations? That's essentially our one day. So trying to give you a predictable system. Again, not getting fancy. What we really focus on in those courses is exams.
Everyday dentistry.
Everyday things. So, sometimes people in the course will try to be like, oh, well, I have this patient who's a type 2 diabetic and I want to... No. That's not today. Let's go back to.
Does it happen more than 20% of the time in your practice?
Right.
If the answer is no, then let's worry about that as the next step.
Correct.
Now, I interrupted you for a second. You were going to mention, I think, the 5 different areas that we focus on. Because one of the things I want dentists to understand is that there's 5 key areas that we focus on and that we believe that there's a lot of success in medical billing. Number 1 is exams. And it blows my mind still to what dentists, number 1 is exams. And it blows my mind still that some dentists don't understand that an exam is your hygiene check, your new patient exam, your limited exam, your post-operative exam. Think about this. Just here's a pearl for everybody. How many post-op exams do you do after extractions where you see the patient for free?
Probably almost all the time.
All the time, correct? And maybe close to $100 a year. Now imagine if you get $20, $30 for each of those.
It adds up.
Mm-hmm. The second component, so number 1 is exams. The second component is imaging. And by imaging, we're referring to radiographs. And that's not just fancy CBCT, although PAs, bite wings, panos, cephalometrics. Now think about this. How many times do you take out a tooth and take an x-ray? how many times do you take out a tooth and take an X-ray, and then do you build it? Do you build the X-ray? So you may not build dental, but certainly that procedure, that X-ray, becomes billable to medical insurance.
Right.
So again, I come back to that simplistic point of it: is don't focus on the fancy. There's literally, when we go in the workshop, when I go through the schedule, a typical schedule in an office, and I say, how many claims do you see here today? Everybody's like, well, maybe 4 or 5. I'm like, yeah, there's 25 claims, easy. And we walk through each patient, and the majority of them come out of hygiene, and the secondary of them come out of our, what we call our side column in our practice, which is typically follow-ups and all of those things. The third thing we cover, so exams, imaging. The third things are appliances. Okay, and that would be things like sleep appliances, of course, but even night guards or TMD appliances, orthotics, things along those lines. Those would be often billable and covered by medical insurance. The fourth area are what I call minor surgical procedures. So that would be extractions. The biggest one to me is granuloma removal. How many times have you taken out a tooth and you scrape, and you take out a cyst? And, that's just part of the extraction in the dental world, but in the medical world, there's an actual code for that with a diagnosis code as well.
A lot of gingivectomies being done for free.
Gingivectomies, especially around crown preps or in perio treatment even. So minor surgical procedures. And the fifth area is trauma. And I think this is one of the most underutilized areas within medical billing because...
By far.
Yeah, how many times do we have a patient, oh man, I fell down and broke a tooth, or, I bit into something and broke a tooth. And a lot of those are all considered trauma. So there's oftentimes, and the beauty about trauma with medical insurance is that trauma suddenly opens up all dental codes, not just medically cross-code dental codes, but suddenly now your crowns and your root canals and things that are traditionally not paid for by medical insurance suddenly become part of the medical insurance benefits.
Our friend that I was telling you I just visited in Indiana, Depeche, we were together, and prior to me going there, he was like, hey, can you just look through my billing? He does his own billing. And I said, yeah, there's one thing.
He's Indian, that's why.
I was like, there's one thing that stands out. And he's like, what's that? I was like, because I know how many patients you see per month. It's statistically impossible that you didn't have a trauma case. Yeah. And he goes, there's not even one? I said, no, there's not even one. And I said, well, is it team members that maybe are missing it, or is it you? And then, he's very straightforward guy. He's like, yeah, it's probably me. I said, okay. This was like a Thursday. Monday, he texted me, and this lady came in, and she, he's a TMJ guy, and she said, yeah, I have like TMD pain. I feel like I have joint pain. And so now, because I put it in his head, he was like, well, how'd that happen? She's like, 4 months ago, I was rear-ended. Boom.
Trauma.
The whole thing just changed. Then she brought her police report, and she brought her hospital report. Now that just went on a different trajectory, that everything he does now for these condyles or whatever
is potentially medically billable. Yeah. So while we're on that, let me bring up another point. I talk about billable things that versus payable. Okay. Billable are those things that you have the right to bill. Payable are those things that you actually get a payment for. But there's a category in between that we don't count as success, and those are claims that got processed, but the payment went towards the deductible of the copay. So those are things that would have paid at a different time of year. And to me, those are the golden nuggets that we need to see when we start medical billing, is to find out what procedures would have paid depending on a deductible
time
issue.
Of year, or deductible.
A deductible, okay. Mm-hmm. So let's talk about, so now we've given some ideas of what we can bill, what people learn in the seminar, what the benefits are. If somebody's on the fence about attending, give me a reason. How would they know if this seminar is right for them?
So one thing I always like to kind of forewarn an office about is something that has a hand in your success that is not under your control is going to be your demographics. And what I basically tell offices is, if you're on the fence, no problem. Take a week, maybe 2, depending on how many patients you see per day. Every single patient that comes in, get a copy of their card, scan them all to one folder. Typically in the upper right or the lower right of the card will be the designation of the plan. And so if you are a very heavy HMO office
or Medicaid office,
Medicare, Medicaid office, you might not necessarily want to do this. Medicaid doesn't have out-of-network benefits. You're not part of them. Medicare, while you can enroll as a dentist, same thing. If you're not part of it, they won't pay you. And that's this. And most HMOs, with the exception of TRICARE, don't have out-of-network benefits. So you wouldn't want to do that. And that doesn't have anything to do with you're in a wealthy area or poor area. That's just your surroundings.
Basically, the jobs people have.
Where I grew up, Woodland Hills, California, and Calabasas and
this is a rich area.
They're good areas, but one of the largest Kaisers in LA County is in Woodland Hills. So obviously they have very good market share in their immediate zip code where they're located,
right? Even
though it's a wealthy area. Just like on the flip side, I've been to some parts of the country that maybe are more rural or you would call depressed, but there happens to be one plant that makes a certain kind of car that has ridiculous medical benefits. So if the
unions have negotiated
so
pretty well.
50, 60, 70% your patients are from that plant, you're good. Yeah. You're fine.
Like we know in our market here in North Carolina, 60% of our patients have Blue Cross Blue Shield, a PPO type insurance.
And your golden one is state
plans. Yeah, the state plans are great
teachers
for us.
And
the teachers,
like
bus drivers. All they're great.
Right.
We have a couple of other employers. We have some good employers. I tell all the team members. The dentists, they look at me like, well, I don't know. I go to all the team members. I say, if I walk and I always walk up to a team member. I go, give me a common employer that you have in your area. And they'll say Caterpillar, for example. I go, if I call you and I say, hey, I work at Caterpillar, could you tell me what my dental benefits are? And like, oh yeah, I can tell you like that, this, they don't pay for this, they do pay for that. And I say, when you go through this exercise, that becomes apparent to you on the medical side too. And we get to a point now when our patients come from XYZ company, we just know. We know what they have. We know, and then once we know what level they are in that company, we know which plan they have within that company. And then we automatically know over time what things there are.
Right.
So in that way, it's no different than dental insurance. So anything else, Hootan?
No. What else do you want? Last topic. What do you want to talk about?
Anything you want, man. I just come back to me, it makes no sense why more dentists don't do medical billing. It's seeing less patients, getting more revenue, getting paid better. Think about you've seen some of our claims. Bone grafts are $1,200, $1,300. Exams for $150, $160. Trauma cases. I had a lady fall down a set of stairs at a nightclub where the light bulb was out, and it was a $15,000 case. We got $7,000 back from medical insurance directly to the patient. I mean, all of these things help build practices. And I think the other thing that I would definitely want to cover here is medical billing is a differentiator. And at the end of the day, when we live in a competitive environment where there's more and more corporate, quote unquote, corporate dentistry around us, more and more other dental practices around us, the name of the game is how can we differentiate ourselves? How can we be more patient-centric? How can we make patients talk about us and refer their family and friends? And I'm not saying medical billing is the answer.
No.
It's just an answer. It's just one more feather in the cap where that first time you help a patient get paid for something, they're your friend for life. They're your patient for life because you made life easy for them.
Yeah, one of the first fairly large trauma cases I ever did, where it was significant. From what I remember, it was like 12 crowns, several implants. The gentleman who was assaulted, it was an assault case, was very wealthy, extremely wealthy, very successful human being. By no means did he need this office to help him. The office did it to this day. I still kind of don't know why, but they did it anyway.
Just their workflow.
Did it. So they submitted the case and it went well. And by now that night the assault was so bad, he had gone to UCLA's trauma center, saw an oral surgeon. His deductible was met, so that's part of the story. So when his claims started going through, 100% payments were coming through up to the allowed amount. Anyways, his thank you to this particular dentist was, okay, well, when I go back, I'm the CEO of the company. Well, he really is. And I'm going to tell everyone who to go to. And it led to, I'm still friends with that dentist, it led to like 45 new patients out of a couple hundred people that work there.
Who all have the same benefits.
Correct.
Yeah, it's crazy.
Awesome Aetna plan. I still remember.
So, to me, that's how you build practice. You build practice by taking care of patients and providing services for them that they would otherwise have to go to other places to get. And that's how you build. Yeah. Hootan, I want to thank you for coming out. And
good,
if people have questions, what's the best way to get in touch with you?
So our company phone number, 306-5106. Website is crossoverdental.com. And then my email is Hootan, Hootan, at codeclaims with an S.com.
Perfect.
Thanks, buddy.
Always great having you.
Awesome.